Thank you.
Thank you.
Good afternoon, ladies and gentlemen. Welcome to our second webinar. And today we have a special guest whom I'll introduce in a few minutes. So first of all, the topic of discussion today is we're going to be looking at occupational health and safety amidst the COVID-19 pandemic. And our guest is really going to be talking through some of the experiences he's had in the workplace. And I hope you enjoy the webinar. And please feel free to ask any questions. Put your questions on the actual sidebar on the screen. And my support team, both Mako and Sheila, are available. They'll be responsible for taking the questions and relaying them through to me and my guest. Just very briefly, in terms of the team screen, if you go down to the bottom right-hand side, you can maximize the screen to get full benefit out of this webinar. So ladies and gentlemen, without further ado, I'd like to now introduce you to our guest. He's Dr. Elton Dawkin, and he's the head of health at Anglo American. He's actually responsible for health across all of Anglo's operations across the world. Elton is a qualified medical doctor. He studied at the University of KwaZulu-Natal, where he got his MD-CHB in 1997. He further went on to WITS and did a diploma in occupational health. Thereafter, I mean, his CV is really impressive, ladies and gentlemen. He's gone on to do an MBA at Gibbs, and through this time, he's really worked all over the place. And I actually know Dr. Dawkin from roughly 16 years ago, and I actually met him when he was at Anglo Platinum's mine, one of the Anglo Platinum mines, and I still remember, Elton, you were basically operating out of a container. So, ladies and gentlemen, I'd like to quickly just briefly introduce you to Elton. Elton, welcome to the webinar, and I hope we provide the necessary information to the attendees of this webinar.
Thank you, Dilip. Yeah, I'm now meeting you from an operating theatre, from a container.
You've certainly moved up, Elton, from the container that you operated in 16 years ago. Yeah. All right, so let's start. So first of all, ladies and gentlemen, we're living in this pandemic, and I'm just thinking about the future. I think 20 or 30 years ahead in the future, children are going to be learning in school about this particular time that we went through, and the date, 5th March 2020, will certainly be a date that will be stored in the history books in the future, because that's the date South Africa got its first COVID-19 case. And to date, we are sitting at roughly 395,000 cases with close on 6,000 deaths. And it's not a pleasant time for us to be in South Africa, but unfortunately, as the rest of the world, everyone's pretty much going through the same thing. So before we continue with the actual questions to Dr. Dawkin, I just need to take you through a short disclaimer. If I can just find my mouse, sorry. The views expressed in this webinar are exclusively those of Dr. Dawkin and myself, Dilip Narvan, and do not reflect those of Anglo American. That's the company that Elton works for, and Altron, that's the company that I work for. All right, so we've got that behind us, and let's continue. So Elton, I hope you don't mind if I call you Elton. There are divided views on how South Africa has handled the pandemic. Some believe that not enough has been done to curb the spread of the virus. Others believe that the government's done enough. I just thought we'll start off this webinar by just getting your view on that. It's kind of a topical thing, and many countries around the world are struggling with this as well. So what's your view on that?
Yeah, as they say, Dilip, hindsight's 2020. I think South Africa always was starting off a low base. We already had significant challenges in our healthcare system, in our economy. And then we then faced a pandemic that no one else has really faced at this point in time. You know, it's sorry, my apologies. Just want to switch off that phone. This is a new thing for the entire world. I don't think anybody could have, you know, predicted the extent of what could have happened. I think there's a lot of decisions when we look back that could have been done differently. But I do think the fundamental challenges that we faced in our healthcare system was always going to put us at a disadvantage, whatever the outcome was going to be. There were things that you couldn't fix up in the space of 6 months in preparation for what was going to happen. They had long-term serious problems, and I think the government is facing that particular challenge. In the media, you see many of the comments that are going. I'm a bit. I always try to put myself in their shoes and ask. Our worlds are, you know, are poles apart. Much more challenges. You're looking after 50 million people. I look after 100,000 people. We have different sets of resources. So, yeah. So, I think what we do need to do is kind of you know, look back at what worked and what didn't work and see what we can fix up going forward. And I think we're in for a tough time, and that we know as we're going through it now.
Yeah. Thanks for that, Elton. So just very briefly, also, you know, when do you think that things will get back to normal? Because that's a question that many people are asking. You know, some people say 5 years, some people say the next 3 months. What's your view on that?
So look, we've had the benefits of watching. You know, Anglo's a global company, so we've got offices. In fact, we had 4 people in Wuhan when this thing started, 500 people in China, Australia, and we've watched this thing develop around the world. We've seen what's going on in the other countries in which we're operating. I hate to be the pessimist here, but our planning is at least till June next year, and that is just first phase, you know. There's some commentary out in the market talking about a 2 to 3 year impact. I think for the foreseeable future, we're going to have to hunker down, get ready for the long ride. South Africa, at least for till the end of the year, things are going to be at least quite tough. Some of our modeling work is, and the stuff that you've seen in the papers is showing a peak in September. I don't think, looking at other countries, I don't think we're going to come straight down like many others, you know, like the UK, which had a very high peak and then came down. I think we may have something more like Iran or Peru or the US, you know, where it peaks and then comes down and then stays at a sustain and doesn't sort of disappear completely. So I think at least plan, you need to be thinking at least till a year from now, maybe longer.
Thanks for that, Elton. It's, you know, with that in mind, it's important for, you know, many of our attendees on the webinar, certainly health and safety managers, some of them managing occupational health and occupational health nursing practitioners as well. So from an industry perspective, you know, you've got expertise in many areas. I know you've started off in mining, you went on to do a whole lot of other things. At some stage, you worked at International SOS as well. What advice can you give to, you know, those individuals that are managing the workforce on a daily basis, and you're really struggling with managing the effects of the pandemic, or rather the virus in the workplace? Yeah,
I think probably one of the big things I can draw on is our experience with HIV and things like TB. Take 2 steps back and try to understand what it is that you're dealing with here. You know, this is a virus. And it's got a certain way that it spreads. It's got a certain way that people are infected, and certain things happen to them when they're infected. And think of it like any other disease, and then design a disease management program. I think that's what we've been doing from the beginning. We asked ourselves, how is this similar or different to other things that we faced? And what is it that we need to put in place for this specific condition? How is it different? COVID-19 and the virus causes a flu-like illness. You know, so there's many programs out there already on how to tackle outbreaks of flu-like illnesses. So I agree that this one is much bigger and much greater than we've anticipated so far, but there are still some basic principles that you need to be focusing on that are around what this disease behaves like, and how and get to understand more and more about how it's spread, how it's transmitted, and then design programs behind that. So, for example, the behavior change element is very important, that we're asking people to do things they've never had to do before. So you need to focus on behavior change. You need to think about design and how your workplace flows, and things you took for granted before about how people, how many people you could put into an office space, how many people you could transport in a vehicle. All of that has to change. And so it would be, on the one hand, what I call pandemic 101. What are the steps? What are the basic principles that one does to approach this? And what are the necessary changes, the difficult, hard changes that people don't find easy to do, that are going to have to become part of our everyday life?
Thanks for that, Elton. So what we're going to do is we're going to quickly just go to some questions. Some of the questions that come through as part of the registration process. And the first question that we have is, are neuropsychiatric disorders such as depression, anxiety, bipolar disorder, and epilepsy considered comorbid conditions predisposing to the COVID-19 infection? That's an interesting question. I hadn't thought of that one before.
So I can tell you on the face of it, and including in our particular world, we don't per se. So we're more interested in your age. So people, that's by far the most powerful comorbid factor. It's not even a morbidity, it's just a factor of a morbidity, you think of a disease, So your age is the most powerful predictor of people who will get severe disease. After that, it's diseases that affect your immune system. So when you go through the list, that's really, so it's something that weakens your ability, diabetes, which really affects your immune system, and multiple other conditions that are associated with your immune system. Now, but when you think about it, for the individual person, we always talk about you should have a controlled condition. So I can imagine things like bipolar disorder, or particularly the mania, that phase where an individual whose disease is not controlled, their behavior may be dysregulated. So they don't follow, greeting people, shaking hands, hugging, those kind of behaviors. So I wouldn't say as a rule, but I would say that somebody who's has difficulty understanding information, what changes they need to, and this affects your actual behavior, that could put you at greater risk. Another thing is that some of these people are institutionalized. Some people with mental health conditions live in hospitals, or they live in facilities, and their risk is not from their condition. Their condition is the reason they're in the facility, but because they're in the facility, they are now at higher risk. So that's how I would think about this, not as the underlying condition, but the consequences of having that condition.
Okay, thanks for that, Elton. The second question is an interesting one. Hygiene in the workplace. Do shoes bring corona to the workplace? I hadn't thought about that. Is that possible?
Yeah, so I've seen some reports. And some of my colleagues have shared about, when you come home, take off your shoes, take off all your clothes, and change, and one of those things is your shoes. So there's a theoretical risk, so somebody coughs, and because corona, the virus lives in your secretions, mucus, spit, and that kind of thing. There's a theoretical risk that you could be somebody could have stepped there, or you sneezed and this and the droplets fell onto your shoes. I wouldn't think it's a major driver. It's not a big cause of it, but it's something to think about under specific circumstances. You go out running, and you step in somebody else's, people cough or spit and that kind of. So I imagine, if I think about it, that would be my answer to that question. But I don't think it would be a major thing. I wouldn't advise people from now on to leave their shoes outside their houses, even though it may be a cultural thing in some circumstances.
Yeah. Thanks, Elton. So another one is, a lot of organizations, that don't normally traditionally do occupational health and safety as it is done in a mining or manufacturing environment. So even offices now so you get non-clinical users that are assisting employees in completing the daily symptom screening forms and so on. So the question is, in the instance where these forms are made electronic, are there any legalities around the non-clinical user capturing this information on electronic forms?
There's users that are non-clinical, but often people themselves in our system, we ask our employees to capture their own information on a cell phone. So I don't see, the question is, you don't have to have 2 degrees to ask someone, do you have a fever? Are you coughing?
Yeah.
So I think it was acceptable to, in my mind. In fact, even if it wasn't, I would defend it. I would be prepared to defend such a thing, even if the law said, hey. So some of the regulations in the mining industry came out saying a registered nurse needs to do the examinations. And we said, you're really just asking somebody a set of questions that, as long as you can show that you've trained the individual, that person does ask those questions. Because often we're asking people themselves, because the next step up is to say to people, complete your symptoms on an iPad screen yourself. And who's the best person qualified to actually say whether I have a fever or a cough or not. So there may be, and I think this is where people need to, understand between the legal frame and common sense around what do you do on a practical day-to-day basis. And I can't see if we ask people themselves to complete questionnaires, how an untrained medical person would not. There are data issues. This is medical information, for instance. So how would I share confidential medical information with, should I, and under what circumstances that happens? That is, I think, more of a problem, because this is personal health information now that is being completed. So the privacy issues are the more important issue here than the legal issue of who should do it or not. It's what that person does with that medical information. So, for instance, in our world where we are governed by the GDPR or the data protection and privacy protection routes, we have to put in place mechanisms where, for instance, if a thermal scanner picks up that you've got temperature, then it's not the security guard who takes any further questions. That you go into a separate place, private place, whoever's there takes it, but that information is treated with due regard to the privacy and the fact that it's personal medical information. I think a similar thing will be in Poppy around how you manage this information rather than who collects it. So that would be the greater risk for me in these scenarios.
Absolutely, Elton. I think you make some valuable points there. We obviously need to consider Poppy and all of the other privacy regulations. But more importantly, if we're storing it electronically, I think it's important that it is classified as either self-captured data or captured on behalf of somebody, because from a medical record perspective, I think the classification of where the information came from is important. Thanks for that, Elton. So let's move on. Many organizations are struggling with screening employees on entering the workplace and, the ongoing screening whilst at work. So, there are guidelines out there, like the previous question was all about, how do we manage this thing from a paper perspective and so on. Could you perhaps just share some light, because, there are automated systems, there are manual systems, and most companies are struggling really from an economic perspective as well. So how, just from your view, what is the most, cost-effective way to do this thing efficiently and still complying with the regulations? Yeah.
So first of all, we need to split up people between those who have symptoms and those who don't. So I still think a large portion of people still have symptoms, and one of those most common symptoms is fever. But you also need to have a strategy for people who are not, who don't have symptoms. Apologies. So the one aspect of this is what you need to process a large number of people. So people like us, or people are coming through on a mining site. You can use large format scanners, for instance. There's also video analytics solutions to do this. It's not just looking for symptoms, it's also behaviors like people getting together in crowded spaces. So we're using video analytics and contact trace, contact badges that measure proximity, cell phones. Cell phones haven't been that successful, but there's proximity measures. So it's not just the screening, it's also the behaviors of keeping people apart. So there's a lot of technologies out there that you can look at to assist you in this work. There's also what you need to think about, what are you going to do about people without symptoms? And you also need to think about what is your plan for that and how do you manage that. The other thing is get people to test themselves at home. So one of the things we did was get a thermometer for every single employee and ask them to check their temperatures in the morning and report that. That takes the testing out of the workplace to another location where it's much easier. Whether people do it or not, some people may be uncomfortable with that, but that's part of what we've put in place as well. A simple digital thermometer and read your temperature yourself before you leave home. Because you don't want to get into transport, you don't want to thing. So that's one additional thing. But as I say, there's the large format screeners, there's the handheld, there's the analytics work. So all of this can be linked up to an AI interface that can find people in the workplace. But I think the other thing is the behavior. How do you manage people and contact at the workplace?
I like that answer because, obviously smaller organizations, it would probably make sense to provide staff with their own little temperature reader, or perhaps even the one that you could stick under your tongue and keep it. It's personal, so you don't share it with anybody else. I think that's great advice. Thanks for that, Elton. So I just want to move on to, you've spoken about technology, and certainly, one of the things that the pandemic has done is it's forcing organizations to move into the digital space faster than ever before. People were talking about these things like 6 months or a year ago, and now most organizations have certainly made the transitions, working from home and moving into the digital space. So with that comes a whole lot of complications and so on. Now I know that you've worked both in a manual paper file-based environment, and at Anglo you've also used electronic health records and so on. Could you perhaps just share, because we speak to a lot of our customers, and obviously many of them are implementing our solutions. Could you perhaps just talk through, some of the best practice, or what are the pitfalls of, implementing such systems in an organization? Because I think, buying the technology is one thing, and that's the easy part, but implementing it and getting value out of it is another. And I know that you've had lots of experience going through implementation and so on.
Yeah, I think that's a very good question. So for me, the first is the pre. Why are you doing this? And are your processes in place? Whatever you're supposed to be doing on paper, do you understand really all of those processes? How do those processes interlink and so on, so that you can design the right solution that you want to put in place. What I see now a lot, Dilip, is what I call electronic paper. You've got all the records, but when you need them, so for instance, the first question we asked when we want to develop a list of vulnerable individuals, go to our systems and you try and pull out that information to give you a view across the company. You realize that it's not stored in the right way. It's not easy to access. It's not, and I think that's all got to do with how would I use this information? What am I trying to do? So the infrastructure and the actual system that you use, I almost feel is commoditized. There are so many good systems out there to store that information. That the insight here is, why am I collecting this information? What am I going to do with it? And how does it change what it is that I do? If that is what your focus is, you'll find a lot bigger demand on the way your information is kept, the way your systems are run. And I think that will drive adoption. And then other pitfalls I find is basic things like not having PCs for the people who are supposed to input the information. That you didn't think that when the implementers were putting this in place, people are not trained in computer skills, and this is in this day and age. These are problems that you're facing today. People are not comfortable to move from the existing systems to the new system because the change management wasn't done. Almost the project management is the easiest part. We're doing this, we're doing that, we're doing that. But actually getting people to understand the value, how does this change? And then there's another thing I talk about. I call it think about system. when you have a problem, don't think about some paper way to fix up this problem, in the short term. Think about what you need to change about your system to give you the answers that you're looking for. Right? So, and I find a lot of people will automatically default to their previous way of doing it, instead of going to their vendor and saying, look, this is the problem that I have. Is it available in your system? Or is there a different way that we can, how can we reconfigure the system to get that done? So getting people to think about their system all the time when they have a problem, not always thinking of another way. So we've got electronic health records. When it came time to collect information, suddenly we're using smart sheets for my information. But I said, but why are you doing that when we've got a system? Or what's wrong with your system? Why don't you fix up your system so that it can do what it is that you're trying to do? I hope I answered that question.
Elton, thanks very much for that. So obviously it's getting a view from somebody who's been through the trenches, so to say, in terms of implementation of the systems. And thanks, you've given us some really valuable input there. I know that some of my colleagues who are business analysts are also sitting in this call, and I hope they're taking heed of what you're saying, because it's not so much what the customer wants. Our systems can do all sorts of things. The customer or the end user really needs to provide the input to ensure that the system is successfully implemented. Thanks for that. So at this point, I just want to take a quick break and go to Marco and to Sheila to check if there are any questions that have come through from the audience. Marco or Sheila, any questions?
Hi, Dilip. Yes, we do have some questions. We have a question here that says, please assist and advise how constantly wearing a mask is effective and if it is healthy. As a long-term wearing of a mask means I breathe in the carbon dioxide I had exhaled, and my glasses are always steaming up.
That's an interesting question, Sheila. Elton, what's your take on that?
Yeah, no, it's a lot of, I think the point probably where we need to use, as it's become more and more clear, as the pandemic has moved along, we forget that this disease, this virus as we know it, is 6 months old. Much that we don't know about it. So when it comes to mask wearing, I don't think the only place you should really, not wear a mask is at home. It's difficult to do this all the time, but it's got to do with who you live with and what the risk is. Then when you're outside in the open, very little transmission takes place in wide open spaces where you maintain distance between people. It's not 100% that you need to wear a mask there. But I do think you need to get into that habit of having a face covering or a mask of some sort, at least for the next year. When you don't know what to do, like often in the situation, it's rather to overcompensate than to undercompensate, whether or not we know for a fact that this works or not works. Because the information, as it stands today, we can't tell you conclusively whether to wear it or not. All we're saying is that this should work based on how this disease is spread, and in conjunction with all the other ways of controlling it, you should do that. There, obviously, so with the breathing and you re-inhaling some of your carbon dioxide and this and that. I don't want to use personal experience. I run with a mask or at least a face covering on, and it's not really that comfortable, and I would accept that. But I'm willing to do it until we know better. And I don't think we know that it really affects your carbon dioxide levels and that it has got a negative effect. We don't know that, but we do know that it can protect you to some extent from COVID-19. So for the time being, at least, it's difficult. It's not easy. Maybe we should do it. When we have more information, when we can say, conclusively, this is the benefit, this is the disadvantage, then let's not do it. As doctors, for instance, wear masks in theater all day. So we have this evidence that, and none of them keel over and die from, they'll operate for 6 hours at a time, sometimes wearing a mask. So we have that experience. Not saying it directly applies outside of that, but we do know of people who wear masks all the time where that wasn't really an issue. But I don't think you can completely discount it and say it's impossible. I don't think so. But given the situation that we're in and the major threat that we're facing at the moment it's not high carbon dioxide levels causing us to keel over. We're not seeing people keeling over and dying from that kind of thing. We are seeing them die from coronavirus infections. And what steps can we take? What is out there? What are the tools that are available to me to use? Let me rather use as many of them as I can to protect myself. And avoid, it's not just the mask. It's avoiding enclosed spaces. it's observing physical distancing, washing your hands. It's easy to focus on one aspect of it, but it's the whole range of things you do that protect you, not any one thing.
Thanks, Elton. Sheila, are there any other questions?
Yes, there are. I have another question here from Heidi. The current manual screening forms require a signature from the patient. The form contains a declaration. If the same form is electronic, is it mandatory for the patient to sign the screening form or not?
Look, that's probably a question that you need to answer. So once again, I think, one of the issues here is how quickly this transition to electronic systems has taken place that Dilip was talking about. Now, there's so many ways to verify identity. It's not just that. What we find is the legislation is lagging behind what it is that you want to do. So I'm going to let Dilip answer whether that, I don't know. And so I think he must answer whether that from legally, from a POPI perspective, this is correct or not. But I think one of the, if it is not, it's one of the, it illustrates a point in how the law lags behind what it is that you can do electronically.
Yeah, thanks, Elton. So from my side, I think you make valid points, but I think we'd need to obviously put the necessary disclaimers if it's been done electronically, and I think for now that certainly would suffice, specifically in view of the fact that we're in the middle of a pandemic and nobody's really going to be challenging that. That's my view personally, but that's one way of getting around it. Sheila, are there any other questions before we move on?
Okay, there's one more here, Dilip. Should we get a sports mask rather than wearing a cloth mask?
Okay, sure. A sports mask.
A sports mask.
Yeah, I think Elton's really addressed the issue around masks. Let's perhaps move on. Is there another question, or I'll move straight into any other question? The rest of the session.
Okay, there's one more here, Dilip. This is the last one for now. Currently, there are security guards that are completing electronic forms on behalf of the patient. They ask the patient the questions, and this reason is to avoid cross-contamination when using a laptop. Numerous clients are not able to advise us if this is legal or not. The form is the daily symptom screening form. Is this allowed? That is security, I think, could complete the form on behalf of the patient.
Elton, do you want to give that one a shot?
Yeah. Once again, I mean, I'm going to take, one of your points that you made. It's a bit of unknown territory. This is it's a new kind of thing. I think for me, the main issue there would be privacy concerns as to what's the quality of the information that you're going to get in those circumstances, would be the question that I would ask. And are there other ways of doing this that are less intrusive? We're putting in a system where if you come into offices, for instance, as a visitor, you do your own symptom check at home on your computer before coming to the office, for instance. So there's a lot of solutions just to think about those workflows around trying to get around that. I like to take it down to the person themselves. Let them make their own self-declaration, and let's give them areas, whether it's an app, data can be an issue, or a computer, but it's obviously not feasible at many sites where people don't have access to those. So I run past construction sites in the mornings, and I mean, it's not really, I can't imagine them being able to fill in an online questionnaire or something before coming to work or doing it on their computer. So what do you do that? I do think there are many electronic solutions out there that takes the risk away from individuals and that completing. And we need to test these things out. Privacy is a concern, but we're all in uncharted territory now. And I don't think anybody's going to go to jail for that under these circumstances. Your lawyers will be able to defend you, but there are some other, we've run into a lot of issues around privacy and the handling of medical data because there are real clear rules around what you can and cannot do with that information. And that's where I would focus my attention.
Thanks, Elton. Right, so we'd like to just move on a little bit now and talk a little more from a mining perspective and large manufacturing and so on. Many of our customers, that we speak to have difficulty with compliance, how to manage compliance, specifically around the DME Department of Labor and so on, and they spend hours trying to get all the data and so on. What's your kind of view on that? And my view, because I'm a technologist, would be simply implement a good system, and it's easy, but it's easier said than done. And certainly from your perspective, you should be able to perhaps have a slightly different view to me. So in other words, what are the pitfalls, and how would individuals overcome these over time?
Yeah, and I think technological solutions are important and the way to go, but there's clear pitfalls. So apps are, for instance, and self-checking are given as one way, but data is a problem, and it's a cost for many people. So we've been lucky that we've got a free app where the data is free in that app, but not everybody has that. So that for instance, is high data costs as in general. It's almost as if somebody should put some kind of free system out there to allow people to be able to use data more. The other one is many people don't have smartphones, so they still need to rely on SMS technology to get messages through. So you need to put that in place. And then some people still the old telephone and hotline. And on our minds, we have all of these. We've got those with smartphones. So you need to give people options. And when you get to site, many people are still not going to have taken any of those routes. So what different options do you give, especially in high volume areas? There's some people, and a lot of our employees are not literate. They're not literate in writing, and they are not going to be able to do the same thing on technologies. So how do you simplify it? But many of them can use an ATM. You don't need to be literate. So how do you make this as close to existing technologies out there? We're investigating IVR. So you do you phone in and you get a number of voice prompts and you answer. I think that's promising. Different languages that you can have this in a language that you understand. You can select that. People can use that. Many people can use that kind of technology. And then non-personal things like a lot, technologies that can pick up high temperatures and so on and so forth. So yeah, a lot of solutions, a lot of pitfalls. And I think the two things is how many people we have to deal with per day, and the varying degrees of technology penetration which our employees have or not have. And then adding additional technologies in the workplace, proximity sensors, video analytics, and so on. There's a lot of options out there, but each of them coming with their advantages and disadvantages.
So, Elton, just from my experience, I've visited many of these facilities. Obviously, I've visited you in the past at the Anglo-Plat mines and so on. And I've always noticed one thing is these long queues at either the PHC or Occ Health facility where they need to be going for their checkups or their medicals and so on. I can't imagine that happening now, because certainly I know that the mines have started off at 50%, and they're probably at about 70 or 80%. I think some of them have already moved to 100% in terms of their labor returning back to work. How's that situation going to be managed? I mean, I think you guys at Anglo are probably on top of everything, but many of the other mines, you can't prevent people from queuing up, and it's very difficult to get them to stay on a meter apart. Just some thoughts on that, and perhaps just share with the attendees of the webinar, what your thoughts are on that kind of situation, because many of them are faced with that.
Yeah, I think that's that's a real problem that many of us face, even despite having the most resources. And so the one aspect, and I think some of our minds have been really good at that, is to completely and totally reimagine, rethink about what it is that you're doing and why you're doing it. It's one thing to enable wasteful technology. Why do we have people queuing? Do we not have enough gates? And it's something that you wouldn't have invested in before. There's not enough, or there's a security risk that everybody needs to go through one gate, or you only have one TNA card. Simple things like that. We have to open up 4 gates, 5 gates. So it's not easy, and many people can't make that change quickly. But there's many design thinking principles around why we allow queuing. Is a classic process control problem. Whether it's queuing of people, whether it's queuing of inventory, and how to get how to get trucks quicker through a border and that kind of thing. So we just neglected these problems because they were not an issue for us. It was okay to let people stand in those lines. When it comes specifically to the clinic, that's for me one of the things that I want to eliminate in the next 5 years. We have to completely rethink where and why we collect information, and what information is useless and what information is adding value. And is there other places and other areas where we can collect? We have the technologies nowadays. I have said there's all of these pitfalls around having that in place. But there's ways for people. You can put an electronic scale anywhere. People don't have to come in on your scale at the clinic. Hearing testing now. There's so many new technologies available that don't have to take place in the clinic. You just need to identify where are those points where you can offer these technologies for people in their own time and in their own space to be able to do the set of tests that make up an annual medical. And then there's some people are not questioning why are we doing this and why are we doing it annually. Some information doesn't, if you read what is supposed to be done, and if you look at the scientific evidence for what is supposed to be done and what you're actually doing in the clinic, you'll find a big difference. So there's a lot of those opportunities out there from a practical, what is it that we test and why do we test it? People are having lung function tests when they're not even exposed to dusty environments just because it's part of the test that you do. People are having hearing tests when they're not exposed to noise. And for some people, they make their money that way. So their job is to convince you to have more medical tests. So for me, it's a multifactorial problem with different points. Some can be addressed by technology. Some can be addressed by process and the way we do things and why we do them.
Elton, I really like that, because essentially what you're saying is let's reimagine how occupational health is done and applying design thinking and some of those other philosophies to that. I completely agree with you. Unfortunately, there's many organizations still base decisions on return on investment, but I think maybe this is something that can be driven out of the academic space, and I know that you certainly participate in those at Gibbs and a few other places as well. It certainly would make for a great study to reimagine how we do these things, and how do we apply the newer technologies. You spoke about hearing. Some of the technologies that are in place today don't even require a hearing booth. So those things are absolutely important, and I think I'm going to look to you, Elton, to try and drive something from an academic perspective, so that we with the technology can follow through and add value to that. I think that's something that we should certainly be looking at. Elton, we're coming close towards the end. I just wanted to ask you a couple more questions, and then we'll go to Sheila and Marco just to see if there are any more questions from the audience. But one of the questions, and this is something that I came up with this week, and there certainly are a lot of these thermal scanning units that are out there. They're based on infrared technology and thermographic technology and so on. But this one customer I was speaking to, he really stumped me because I didn't quite know how to deal with this. Is that he says his employees walk 5 kilometers from the township to the factory, and in winter now at sub-zero temperatures, by the time they get to the workplace, the handheld thermometer just doesn't work because it cannot operate at those temperatures. And he's asked about what sort of technology. I mean, is there anything that can go through subdermally or something like that? And I really thought about that, and I said, gee, that's one that really has stumped me. Have you guys, through you guys operate worldwide, you probably come up with this kind of situation, especially on the mines. How's that addressed?
Yeah. So, sometimes it's not fair for us to talk, because we have teams. I have a separate team who looks at the specifications of the stuff, works out under what conditions it works, and then what it doesn't, and it doesn't. It's a different world to a SMME, a guy trying to run his small business down there and trying to rely on these technologies. But there's no escaping the quality and the specifications and the ranges within the equipment that you work. And many of us get caught out, because, it's not something that you're an expert at. You can't get good advice on which of these things there are that work. Of course, if you look, so we've got a test pilot that we're running now, I think about 10,000 of the skin patches that you put on that you can measure, so somebody can monitor their temperature. So let's take high risk people where we want to know soon. We can stick on this dermal technology, and that can give us an answer. There's still the old machines that which is very reliable. The ear, your tympanic membrane, your eardrum, temperature on your eardrum is a lot more accurate than the temperature on your skin. These things cost money. They're not easily available. So I think it's trying to get something that's reliable, that's within your price range. And then there's buy your employees their own thermometer, man, and let them so that's quite cheap. 14, 15 rand, it clicks. You come to work with it, you stick it in your mouth, it's yours, and you check your temperature. Very low tech solution to this thing. Show it to the security guards at home. You get to use this as well if you just feel like you've got a fever and that kind of thing. But it doesn't help. So for the small guy, and that's often some of my friends who run small engineering factories and this and that, I said to them, buy your workers a set of thermometers for you. And when you come to the office, it's in your little box there with your name on it. It's a lot of low tech, a lot of high tech. In the beginning, we were being sold a lot of junk, and we had to sift through what is the good stuff, what is the bad stuff.
Yeah. So, Elton, it's a great answer. I like it because, sometimes we are thinking too much about how technology can solve these problems. And you've come up with a simple answer in terms of how to deal with the issue, and essentially you're getting the same result. The other thing, whilst you've been talking, is I thought about it and I said, maybe what this factory owner should do is get these guys to start later in the day. Why start at 6 in the morning? Start at 9 o'clock so that you don't have the issue with the anomaly in temperature early in the morning. So there are other ways, and I think that's one of the things is, thinking creatively, and you can get around some of these issues that we're facing. So Elton, just one last question, as I said, before we start winding down or closing this webinar is are there any case studies that you can talk through in terms of, what has happened either within your operations or internationally from a COVID perspective? Could you perhaps just share any insights? Do you have anything that you can talk through?
Yeah, there's quite a lot that we've done. We've done probably a lot of technology as well. But I think probably our biggest thing has been to get our own PCR laboratories. So starting at the beginning of this program, we realized that testing is going to be an issue. And if you followed the news reports from early on, that was going to be the case. So what we did was we basically put a lab plus lab technicians on each operation. Just because of the numbers that we deal with, we believe that it's all well and good to do all of the screening stuff. But if you test positive, if you've got a temperature or you've got symptoms, you need to be tested. What's happening to testing capacity in this country? Can you get tested? How long does it take? So that's the problem. That's when thinking about this problem. So what we did was to get our own testing ability. So Anglo has now in all of its minds and it's something that we're also extending to our local communities as well, because so we have no delays with testing and for me testing is about prevention. Once you know that, it's one point to know, oh, you've got a fever, you've got symptoms. The next step is to get a test. And if there's a delay in that, you need to isolate, you need to do contact tracing. Any delay in getting that test compromises. So the best thing is not to get infected in the first place. But the second thing is once you're infected, to get tested as soon as possible so that you can self-isolate and those around you we can know what to do to assist you and to assist those around your contacts. So that for me is prevention, and the sooner you can do that, the better it is for you. And for us, and it's not just a South African program, it's a global program where we've made sure that testing is available. There's no to our employees and their families, and because there's a lot of capacity with these tests to the local communities. And I think it makes a big difference. It does. When you look at how much testing we're doing, it's far more than what is happening in the government or places outside of our minds. But that's something unavoidable because we We believe it's something that you need to do. And if you want to have visibility, if you want to know what's going on about this disease, you need to know who's infected and who's not infected. Many people will have fever and they don't have COVID as well. Yeah. So you want to know that so that they can, spend 1 or 2 days and then go back to work, as opposed to those who need more treatment, isolation, and so on. And you can only, if you're waiting 7 days for the test, you're not going to be able to manage this condition. And that's probably one of the big drivers of our problem in this country, and how long it takes to get tests back. So yeah, that's one of our stories.
So Elton, I think before we close, let me just check with Sheila and Marco. Are there any other questions that have come through?
Yes, Philip, there are 2 more questions that I'd like to ask. I see another one has just come through. The first one is, what type of statistical reporting do you think a doctor would want with regards to the COVID?
So, yeah, Elton?
So we have a public health team on our team whose job it is to get out all that information. So I think there's so many different aspects of this. So for us, we're interested in, number one, how many people on a daily basis are being infected on our operations? How many people are symptomatic? How many are asymptomatic? Where are they reporting from? Are they reporting, as I said, we've got this app, you report from home, or we're testing them at the gate? Or are they being tested inside the workplace? Where do we pick up people? Then we're asking more complicated questions: is how quickly are infection rates going up in any one particular location, any one particular mine, so that we can act. Because if you see that this is going, 1 or 2 patients every day, no problem. If you're getting doubling every day, that's a different problem and a different question that you need to answer using your data. And so I think from a statistical perspective, and we spend a lot of time on the data. I mean, one of the points, Dilip, I wanted to make is we've moved from systems now. We're not only into it, the system must be good, it must work, people must use it. Yeah. We are interested in data. So our focus is not on the system. Yeah, we want a good system that works, that's reliable. We want the data. The data is where decision and the information and the wisdom is about what to do. And so I mean, we look at a number of parameters around what is going on. Even the quality in our labs, all of that is information of all the people who are persons under investigation who have symptoms. How many actually test positive? And that's probably one of my most exciting and fulfilling parts of this, is the amount of data that we can get. But that data must drive decisions. It must change what you're doing. It must save lives, and that's what we're really about. So, and I don't think you can escape using statistics. If you're not using statistics and you're not interpreting those statistics and they're changing your actions, then you're not doing as good a job as you could do. So very, very useful.
Great. Elton, thank you very much. I think, Sheila, we're not going to take any more questions now. And what we'd like to do, ladies and gentlemen, is firstly, I'd like to thank you, Elton. Thanks for your insights. Thanks for making some time available to chat to us. Really appreciate it. And, I look forward to chatting to you soon. Ladies and gentlemen, what I'd really like to do now is really just take you through a short video on the solutions that we have within Altron Health Tech. And straight after that, we'll close the webinar. Thank you. Keith?
The future of occupational health with Altron Health Tech. Health and safety oversights and poor record keeping have a long-term impact on company profitability and sustainability. A study conducted at a South African gold mine found that during the early 2000s, thousands of production hours were lost due to expired health certificates that prevented miners from going underground, all due to a manual system that could not keep track of all the variables. To make health and safety work is a complex matter, mostly because there are so many disparate systems in the chain. Altron Health Tech offers a solution to this problem by integrating all these systems. Typically, Organizations are faced with multiple disparate and often manual systems that are inefficient when it comes to reporting. Additionally, the lack of automation can result in non-compliance to the Occupational Health and Safety Act and other industry-specific requirements. Altron Health Tech has developed a solution that can now enable organizations to meet their occupational health and safety compliance easily. At the same time, our solution ensures an efficient work environment. Integration is the true superpower of Altron Health Tech's Electronic Health Record, EHR. By integrating an employee's personnel file into the electronic health record, a single source of truth is ensured. Based on the workplace medical surveillance matrix, each worker has an individualized risk and monitoring profile against which health checks must be scheduled, carried out, and reported on. The electronic health record has details of the risk exposures, and an automated action plan drives the workflow process to ensure efficient processing of the employee through the clinic. Furthermore, as the employee moves through different workstations in the clinic, data from diagnostic devices are integrated into the EHR automatically. At the end of the testing process, the occupational health doctor now has a summary of all the important parameters, allowing the doctor to create a certificate of fitness. Linking into time and attendance, the system ensures only employees with valid health certificates are allowed back into the production environment. Altron Health Tech's EHR solution collects data from multiple endpoints, allowing for extensive reporting, which can be generated at a population and individual level. By having reports at your fingertips, compliance requirements can be easily met. Compliance with the Occupational Health and Safety Act is inescapable and can be a competitive edge instead of a costly and time-consuming management headache. As a trusted healthcare technology partner, Altron Health Tech has the solution to ensure that companies have the tools to improve productivity and employee well-being well into the future. Contact Altron Health Tech to improve your productivity and take the headache out of occupational health and safety compliance.
Ladies and gentlemen, I'd like to thank you for joining us in this webinar, and we look forward to chatting with you sometime in the future. Thank you very much.